Today I'm going to answer the question of, is physiotherapy necessary before knee replacement surgery? I'm a specialist physiotherapist with Next Level Physiotherapy. This channel is dedicated to helping people get out of pain without relying on medications, injections, or necessary surgery. If you find these videos helpful, please consider subscribing so you don't miss out on our weekly videos. So let's take a step back and define what physiotherapy is. So when most people think about physiotherapy, they think it's all about exercising, massages, maybe stretching, ice packs, cold packs. The truth is, it is a lot more than just that. Physiotherapy really includes patient education to empower you with the tools to be successful outside the office. And the physiotherapist should address all your questions and concerns that your surgeon might not have had time to answer. Some of the more common questions we get in the clinic include, what equipment do I need after surgery? How should I sleep? What motion should I avoid after knee replacement surgery? How long does the pain last for? Going to physiotherapy before total knee replacement surgery is the best way to prepare for knee replacement surgery. You get a chance to meet with a physiotherapist that you're going to be working with, so you know what to expect after the surgery. You also know that the rehab process will take some time, so you want to make sure that the therapist that you're working with has your best interests at heart and you guys are on the same page. If you're going to spend some time with a therapist anyways, you want to make sure that you can actually connect on an emotional level. The surgeon has to cut through the muscle of the leg. They have to open it up, they take out the joint, they replace a new joint, and they sew back up the muscle. When they cut through healthy muscle, it's a guarantee that coming out of surgery that the muscles are going to become a little weaker. And when the muscles become weaker, you're going to have some lag time before you get back the muscle stronger. So when you go into surgery, you bounce back faster. Some of you have such bad knee pain right now that you can't tolerate any knee exercises. You can still strengthen your hip muscles, your butt muscles, you can make your feet and your ankles stronger. And that in turn will take pressure off your knees, so then when you come out of knee surgery, the other parts of your body can work more efficiently to help the knee heal faster. If you fail to plan, then you're planning to fail. Going to physiotherapy before total knee replacement will give you more clarity on what to expect post-surgery. Plus, on top of that, you'll have a team that you handpicked yourself that's ready and willing to work with you after the surgery. And best, it reduces the stress of the unknown. Now, there might be several of you right now watching this video who already had knee replacement surgery. So if you did, please comment below on what your experience is like. Did you go for physiotherapy before knee replacement, or did you wait till after knee replacement surgery to go for physiotherapy? If you found this video helpful, please consider subscribing and hit the like button. Move better, age stronger, and I'll see you on the other side.